Welcome back, you guys. It is March 2nd, and the month of March is Colon Cancer Awareness Month. This is something that I'm so passionate about as I lost my father to colon cancer. I'm sitting here with Take Him, who is from LDS Hospital. We are talking about the signs of cancer. And colon cancer is one of the most preventable cancers, right?
Absolutely.
Yes. What do we have to do? This is what I think is the most important thing, is awareness of how easy it is to prevent.
Yeah, the most important thing is to remember that there's no symptoms, so don't wait for that. If you get a colonoscopy and to catch cancer early, over 80% is curable just with surgery alone.
Which is so important to know. Now, my dad's situation, he went in when he was 50 to get his colonoscopy, and he had polyps. Now, he didn't really have any signs, but what are the things that we need to know before we get a colonoscopy? What things should we be paying attention to? Well,
the number one risk factor is age, so we can't control that. So anyone over the age of 50 absolutely needs their colonoscopy.
Yeah.
If you have family history of polyps or cancer, then you should consider getting it earlier.
And I have to say, I decided to get a colonoscopy just randomly at 32 years old, which was 2 years ago, and I had 2 precancerous polyps.
Yeah.
So now I have to go in every 2 years to get a colonoscopy, and I'm young, you know, but I feel like they need to lower the age. I feel like it seems like a lot more young, healthy people are getting colon cancer. What is that?
It's interesting. Yeah, it's interesting because over the past 10 years, we have found that colorectal cancer is happening at an earlier age. We don't understand why, but 90% of all colorectal cancers happen after the age of 50. So that's why we can't change the recommendations.
Yeah.
But certainly if you have risks, so family history of polyps or colorectal cancer, you should get it done earlier.
Right, which is on to number 2, is have you had a polyp, or if you've had cancer in the past, that's obviously a reason for you to go in and get a colonoscopy. The other thing I want to make people aware of is it's really not as bad as it sounds. You know, I feel like it sounds like this awful thing. It's embarrassing to talk about, but it will save your life. I sit and think all the time, if I wouldn't have gone and got that colonoscopy, who knows what would have happened. And I just had a feeling to get it and did, and I'm so grateful that I did.
Yeah, absolutely. So, I mean, really, the night before is the worst part. You're just kind of pooping all night long.
Yep, pooping all night long, people. You just grab a bottle of poopery, and you sit on the toilet, and it's one night of just pooping.
But the next day, you get the best nap ever.
Exactly. and just the peace of mind that comes with that is so important.
Correct.
What are some of the signs of colon cancer?
So again, I stress that you should get it done before you get signs.
Right.
But signs are very vague, and that's another problem. But the most common touted one is the blood and stool.
Right.
But also remember black tarry stools. If you have strange abdominal pain, that also can be, but that's a very rare indication.
Right. Another thing that I thought was important to look at is, do you eat more fats than fiber? And that's...
So on a society standpoint, absolutely. So the more fat you eat, the more likely you are to get colon cancer. But if you remember that most of the people getting colon cancer are over the age of 50. So them changing their diet right then and there, it probably won't influence their cancer risk, but it'll increase the likelihood that you'll keep a healthy heart. So.
Right. And then have you had inflammatory bowel disease, such as, what does that say?
Ulcerative colitis and Crohn's disease.
Thank you.
No problem.
Thank you so much for that.
That's
which is what? What is that?
So it's we think it's kind of an autoimmune, we don't really know, but it's where your body just attacks the colon. And because that chronic inflammatory state, these people are actually at higher risk of getting cancer if we can't control the inflammation. So those people need to be screened on a more frequent basis.
Yeah. I love that we were talking during the commercial break. Oh, really quickly, have you noticed persistent changes in your bowel habits? That's a good one to pay attention to, too.
That is, and that's a very common thing. Unfortunately, there's a million reasons why that can happen. So a lot of people get very concerned about that. But certainly, if you have that and you're over the age of 50, just get a colonoscopy.
Just get a colonoscopy. That's what it comes down to, you guys. I love that we were talking during the commercial break about how we want to do a 5K together and bring more awareness, and I'm really hoping to work more closely with you guys about bringing awareness to all of this. If you guys want more information, you can go to ldshospital.org or go to our website, and we can link you to more information on what to do if you need to get your colonoscopy, which you need to do B-Ray, have you had your colonoscopy?
I haven't yet, but apparently I need to prepare myself for one of those big days where I'm just sitting on the toilet the whole
Sitting on the toilet
day.
pooping.
There you go. Thanks, Michelle.